Why do we love our superheroes? Because they do big, mighty jobs. Anti-aging is no child's play, and one such superhero in this game of anti-aging is retinol. Today we'll talk about retinol, the most powerful anti-aging ingredient, the most Googled anti-aging ingredient, and FDA approved for cosmetic results, retinol. Hello friends, I am Dr. Geeta Grewal. I am a cosmetic surgeon and a founder of 9 Muses Wellness Clinic and 9M Skincare. And today I'll talk everything about retinol. What is retinol? How does it function? Who should use? Who should not use? What you should combine and what you should not combine, and some internal details about how it works on the cell and how it is giving you these amazing benefits. So let's get started. What is retinol? Retinol is a vitamin A derivative. It was discovered way back in 1909 from the fatty cells of egg yolk. It is a yellow color crystal. So anything in nature, if you see has vitamin A, it has that yellow orangish color. And if your creams don't have, then it should raise a question in your head that do they really contain retinol, though the packing says it is retinol. It is a yellow color crystal, and that can identify that retinol is there in your cream. Also, it's a very highly unstable molecule to UV light, to air. That's why the whole scientific mechanism is to source it from the natural sources, from egg yolk, from liver, from carrots, pumpkins, all the yellow and orange stuff in nature, and pack it to make it penetrate the skin and reach the functional level of the skin. That's the science behind making this molecule. The molecule is FDA approved for its cosmetic benefits. Various natural occurring retinols are there: retinol, retinaldehyde, tretinoin, retinyl esters, retinoic acid. So you see all these ingredients written on your bottle. Retinyl esters are the weakest to perform, and retinoic acid is the strongest in its performance. In skin cell, all these types of retinol are converted into retinoic acid to give the result. How does a retinol work? Retinol impacts the nucleus. Any hormone, they function through the nucleus. The nucleus of the cell gives the command and the cell follows. So retinol works like a hormone, that is vitamin A is working through the hormonal pathway in a skin cell, and these RAR receptors on the nucleus trigger the cell to function. What all commands do they give? They give a command of cell differentiation. They give a command of exfoliation, that is removal of the dead cell. They give a command of increasing glycosamine glycans, elastin, collagen in your skin, decreasing the pigmentation, decreasing the sebaceous activity, that is shrinking your pores. So we all want all this when we are looking for an anti-aging regime, isn't it? Not only this, it also blocks the collagenases and gelatinases activity. These are the two enzymes that break collagen in our skin. So retinol blocks their activity. So not only it gives stimulation to your collagen, it decreases the activity of enzymes which are breaking collagen. So double benefit, isn't it? And also retinol blocks the UV damage to the skin. The UV rays cause the reactive oxygen species formation in skin, and these reactive oxygen species, they further trigger a cascade which causes various changes in the skin, different texture, pigmentation, breakage of collagen. So retinol also blocks the UV damage effect on the skin. Tretinoin out of all these is FDA approved for the cosmetic benefits, and it is the strongest, that is the retinoic acid, and it has been shown that it gives significant improvement, cosmetic improvement on the skin, that is increasing collagen, decreasing fine line wrinkle, decreasing pigmentation, and boosting the skin health in span of 8 to 12 weeks. Let's talk about the benefits of retinol. So once you start using retinol, you will see it improves the collagen, elastin in your skin. It polishes your skin. It gives that nice rosy dew look to the skin. Way back in college, I had a lot of acne and in my medical college, and the dermat told me to apply retinol on the acne. But I just applied all over my face and it gave that rosy dew glow to the skin, which I really loved. Anyways, now everybody says you have to apply on full face, not just certain areas on the face, and that helps in improving your skin health, boosting your collagen, decreasing the roughness, decreasing pigmentation, decreasing skin elasticity, decreasing the laxity in the skin, improving the skin elasticity, shrinking the pores, decreasing pigmentation. And these are all the things that we want when we are looking for something which is anti-aging. Do let me know if any one of you are using retinol, planning to use retinol, or are already using, and how's your journey? Have you found the results? Have you found your products effective? And what challenges you're facing? Put your comments. I'll be more than happy to reply to them. And let's move forward. Who should avoid retinol? If you don't have a basic skincare in place, that is morning, evening routine, you don't use SPF, you don't use moisturizer, and you're not disciplined, then I think first build that discipline and then introduce retinol, because retinol is, as I said, a very powerful superhero of anti-aging, but it requires certain base to get retinol into your skincare routine. That is moisturizer and very dedication with moisturizer and your sunscreen. If you're planning a pregnancy or you're pregnant or you're breastfeeding, then avoid retinol. If you have any active infections on your skin, then you should also avoid retinol. How to use retinol safely? Retinol, we all know, causes some amount of irritation. But the thing is that if it is not causing irritation, it is also not working. That is very clear. So be mentally prepared that it will cause some amount of irritation in my skin, and I should know how to handle this irritation. I will give you 2 rules to start your retinol. One is MRM, that is moisturize, put your retinol and moisturize. So that's also called as a sandwich technique. So when you're a beginner, do moisturizer first, then put small amount of retinol, and then again put moisturizer. So the amount of irritation will be less, and slowly you will get used to the molecule, the skin will get used to the molecule. Retinol is important, and it is just like when you're starting gym. When you go to the gym first time, after the gym, you feel the muscles are sore, but then you don't give up the gym activity, isn't it? Same as retinol for your skin. It will make the skin little irritable, but then you should not stop using it. You should understand that I have to stop the ingredient right now and I will do moisturization, so that now again I'll prep my skin and again introduce retinol. Second method is 1 to 3 method, whereas in first week of your retinol beginning, you do it only once in a week. In second week, you do it twice in a week, and in third week, you do it thrice in a week, and then you get to either daily, or you can, customize it according to your skin type, because skin is exceptionally dynamic. It is different in the morning, it's different in the afternoon, different at night, different in season, different in your month cycle. So you need to understand the dynamic of your skin before you introduce this powerful molecule, and don't land up in complication with this. So just to repeat, I told you, be mentally prepared. It will give irritation, because if it's not giving irritation, it's not working. Also, what you can do is start with a lower percentage, like 0.025%. Then shift to, once your skin is used to it, like you're starting a gym, you straight away don't pick 20 kgs, you start with 3-4 kgs first. So start with small percentage, 0.025%, then step up to 0.5, then step up to 1%. Actually 1% is actual strength that gives anti-aging benefit, but that doesn't mean 0.025 will not work. So start slow, start least strength, and slowly pick it up. Use moisturizer whenever you have irritation, and do the sandwich technique, do moisturizer first, then retinol, then moisturizer, and this will certainly help you. Do let me know if you have had irritation, how you have handled, and have you stopped or you're still using a retinol. Now, out of the various names of vitamin A derivative that I told you, like retinol, retinoic acid, retinaldehyde, you can start with retinyl esters. They are less irritant, but then they are also least effective. I told you retinol, if irritation, result for guarantee is there. So retinoic acid is the most potent, then retinol, then retinaldehyde, and then retinyl esters. Another thing that you really need to look into is that don't expect immediate results and start assessing your skin after 2-3 months of use. And it's actually 3-4 months time that skin cell take, because the differentiation message is given, but cell take time to build up. So actual effect, a long-term effect or a substantial effect you will see in 3 to 4 months of time. First week you will feel skin to be little smooth. In oily skin you will feel that your oily activity is going down, your pores are shrinking, and in dry and sensitive skin type also you will see the collagen buildup is happening and the skin strength is improving, but you should use a retinol cream. Oily skin should use retinol gels and serums, but if you have dry sensitive skin, then make sure your hydration is proper and use retinol creams. What you should not combine retinol with: AHA, BHA, salicylic acid, glycolic acid, benzoyl peroxide. All these are further peeling agents, so you don't combine this. And also you should not combine vitamin C, and make sure you're using retinol at bedtime because it is very sensitive to UV light and it unstabilizes, and it will not work if you do it at the daytime. Also sometimes it can increase the photosensitivity to the sunlight and you can have side effects if you use it in the daytime. So always make sure that you use it bedtime. What all you can combine retinol with to get that extra benefit and boosting effect? You can combine with hyaluronic serum, you can combine with your peptide creams, your growth factor creams, your niacinamide serum, azelaic acid serums, and your ceramides. So these are excellent. If you combine, you will see an extra edge of performance of retinol with this. So now just to recap quickly, you can start slow, you can mix moisture, retinol, moisturizer, you can do 1-2-3 method, you can go slow, and always keep your moisturizer very handy. Any irritation, stop, do moisturizer, then again restart, but don't stop your journey with retinol. And if you are a serious enthusiast about skincare, I'm sure you will not stop it. Thank you for watching this video. I hope you liked and you learned something new about retinol today. Do give a thumbs up and subscribe to our channel and share with your friends who like watching such videos on beauty, health and wellness. And I shall see you soon. Take care till then.